our team got to research antisocial personality disorder.
In order to be diagnosed, according to the DSM-5, you must be at least 18 years old with 3 or more symptoms. These symptoms include recklessness, lack of remorse for others, such as not understanding boundaries, impulsivity, making irrational decisions, lying, not conforming to social norms, such as engaging in criminal behaviors. Individuals with ASPD are more likely to engage in criminal behaviors according to the psychiatric rep in 2013. Think of some of the criminals in Criminal Minds. Those who we consider a little off, a little socially awkward. Now, I'm not saying that if you have ASPD that you will be a serial killer, but many of the criminals do lack remorse as well as impulsive decision making and not following laws. There must be evidence of these symptoms from childhood from before 15 years old, and they have to be very consistent. This disorder is an association to many others like depression and anxiety.
According to research, Warner, Few, and Buchholz 2015, ASPD is a serious mental health condition associated by persistent patterns in disregard for others. It's found that 1 in 4% of the general population, but is more prominent in males. Many people with ASPD battle substance use and depression. Genetics do play a role. Up to 69% may be inherited. Also, early environment and childhood trauma or neglect could be triggers. Being diagnosed all depends on the chronic patterns that show in childhood and may continue into adult. ASPD also coexists with externalizing behaviors like aggression, impulsiveness, and risk-taking in common genetic roots. Understanding ASPD is a more than diagnosing a behavior. It's about recognizing all environment, development, and complex interactions of biology. 7 criteria a person must meet from the DSM-5 must at least meet 3. Repeated law-breaking behavior, deceitfulness like lying or conning others, impulsivity or failure to plan ahead, irritability and aggression, reckless, disregarding for the safety of others or self, consistent irresponsibility, lack of remorse after harming others.
Antisocial personality disorder has been recognized for over 200 years. It is a disruptive and widespread disorder that affects society, individuals, and families. It is characterized by patterns of social irresponsibility, guiltless actions and behaviors, and explorative behavior that affects people's schooling, work, and family relations. Such behaviors can include getting into trouble with the law due to failure to conform, hardships maintaining consistent employment, and struggles to sustain good, stable interpersonal relationships with others. ASPD affects individuals' ability to empathize with others, rarely feeling remorse, which causes them to not learn from their mistakes. The prevalence rate of ASPD is between 2 to 3% in communities and as high as 60% in male prisoners. In general populations, ASPD ranges from 1 to 4%. The population most affected by ASPD overall is males, which are 3 to 5 times more likely to get diagnosed with antisocial personality disorder. In the general population, make males up to 6% and women only 2%, meeting the DSM-5 criteria for ASPD. In a rigorous study, estimates of ASPD were reported to be over 70% in the population of males who suffer from substance use disorders. In the picture behind you, it is a good representation of people who have had ASPD, including fictional characters as well as real-life characters. You can see the difference between how it affects men and women and how men it's more common.
Talk about treatments. The NICE emphasizes how treatment for ASPD largely depends on the person's age, history of drug or alcohol misuse, and willingness to participate in treatment. And according to Black, there's currently no medicine approved by the FDA to treat this disorder, so psychiatrists often try to target co-occurring disorders such as depression or bipolar disorder in hopes that it will improve the ASPD. The NICE in the UK has used lithium and carbamazepine to treat certain symptoms of ASPD, such as aggression and impulsive behavior that may improve anger and overall aggression in these individuals. Black discusses the treatment methods of talking therapy, such as cognitive behavioral therapy, and how it's often utilized to help patients consider the way they think and allow them the space to process how their mental health affects their behavior. A small case series conducted by Davidson and Trier showed CBD was helpful in reducing antisocial behaviors of verbal or physical aggression, suggesting that this treatment may be promising with larger studies that could show its true effectiveness. Democratic therapeutic communities are also recommended by Black and are growing in popularity for people with ASPD. This therapy addresses people's emotional and psychological needs in smaller, large group settings where community issues are discussed. And the 18th-month treatment process gives people an opportunity to contribute to conversations and decisions made in a safe space where they can put newly learned social skills into practice. Treating this disorder can be a daunting task that many professionals refuse referral to, so it's important that those treating ASPD understand the challenging nature of individuals with this disorder.
Include antisocial personality disorder is a disorder that affects one's actions and especially how an individual interacts with others, which can make it problematic for them to make and keep relationships. To be diagnosed, one must be at least 18 years old, and that makes it harder for any intervention or prevention to be made. In addition, there being no clear or gold standard treatment for the disorder at this moment, which makes it harder to help someone that has the disorder. That being said, there is research that indicates that the disorder might be related to genetics, as mentioned earlier in the video. Both there being a lack of treatment and knowledge of the cause for the disorder, more research is needed to have a more complete understanding of the disorder.